Hello, I'm Dr Thiruselvi Subramaniam from IMU University, Malaysia. Today I'm going to share my thoughts and my students' feedback on a patient safety workshop that I conduct for final year students to create some awareness about patient safety. Now, just to talk to you a little bit about what we do, from year one in our medical school, our medical students complete a structured online patient safety module. It's not just one module. Every semester there's something that is needed to be completed. They learn terminologies, the principles and the frameworks to start with. And when they start their clinical posting, they start to spend time in the wards and clinics where teaching is done at the bedside and patient safety becomes an integral part of their learning. Now, what we need to understand is knowledge and exposure do not always translate to awareness. Okay, so when they step into the wards every day, they look at patients, they talk to them, they examine them, they observe. But patient safety is not always visible to the untrained eyes. It hides in routine that happens in wards every day, in assumptions and in silence. It requires a different way of seeing. That's why at the start of the anesthesia posting in final year, we begin with a dedicated patient safety workshop. It's designed to to teach patient safety and to help them truly see it for what it is. Because I believe safety begins with how we see. A little bit about the workshop. It's designed to shift observation into awareness and focus on medication safety, communication gaps, human factors, and blood transfusion safety and a few others. Simulation is used to expose how small oversights align to create harm. It encourages also confidence to speak up across hierarchy. So at the end of the day, the goal is to create awareness and turn it into action. I'm going to share some short video clips on my students' reflection.
Hi guys. Hello everyone. After attending the patient safety workshop, one thing that really changed for us was how we look at simple ward practices, especially bed railings. Previously, we didn't realize how important something as basic as putting the bed rails back up could be. Now, whenever we finish examining a patient or see a railing left down, we make sure to put it back up, especially for elderly or high-risk patients to prevent falls.
Yeah, true. And another thing that we became more aware was about blood transfusion safety. We didn't realize how much information is there in that little bag, important information like patient detail, blood group, expiry date, and so on. Now we consciously even check these details and understand why verification is so strict. So the workshop basically helped us move on from just observing ward routines to actively thinking about patient safety in every small action.
Hi everyone, Samuel here. So the patient safety workshop really benefited me a lot, especially in teaching me how to identify the common mistakes healthcare professionals make when prescribing medications. I still remember there was this one incident where my friend and we identified a patient who had received the wrong set of medications. And that was actually because he had the exact same name as another patient in the ward. But thankfully, because of the knowledge we gained during the patient safety workshop, it gave us the confidence to identify the problem and to escalate it to our seniors as well.
The message I'm trying to convey is that patient safety is not an additional topic. It's the foundation of safe practice that is integral to everything that we do. And if we want a safer healthcare system, we must equip our students with awareness, courage and system thinking. Because safe doctors are not just clinically competent, they are safety conscious. Thank you.